Well, many women worry about that when they have very painful periods. They worry about endometriosis. What that means is are the lining cells of your uterus. When you menstruate, these lining cells just slough off, and that's the menstrual blood. However, sometimes those lining cells don't just go out the cervix and out the vagina. Some of them go back up through the fallopian tubes and go into the abdomen. And then you can have implants of endometriosis tissue where it shouldn't be. Maybe in the peritoneal cavity, maybe right on top of the ovary, maybe inside the ovary. And so it can cause tremendous pain when you're menstruating because this blood has no place to go when it's in the ovary in a sealed space in the body. So it can cause a lot of pain. However, there's been way too much surgery for endometriosis, where women who are infertile, it's not going to make you more fertile. It's not going to help you get pregnant. IVF is really going to work just as well if you have endometriosis that's been untouched versus if you have no endometriosis versus if you've had endometriosis all surgically removed. It's really not going to affect anything except that sometimes it causes fallopian tube to be stuck, and sometimes inside the ovary it pushes out healthy eggs. But we can handle it very simply just with needle aspiration. And so in surgery can destroy so many eggs because the eggs are all located on the outer shell. So be careful about treating endometriosis. It's really very common. It's not really a cause of infertility. We know that from all control studies, but it can sometimes reduce your ovarian reserve if it's in the ovary, and sometimes it can cause the tube to be adhesed and scarred, and so in some cases it can cause infertility. For the most part, it's a good idea to ignore endometriosis and just go right to IVF before your eggs get older, before someone operates on it and destroys a lot of your eggs inadvertently while they're doing the surgery. So endometriosis is a big common story, and I'm happy to talk to anybody about it. We really understand it very well.